Hi, Joe 200. Here we are again. All right, so we're starting a new module. As we can see right here, your critical thinking assignment was due yesterday, Monday, September 17th. Um, it was pretty straightforward stuff. You had to go dig around into a site that has lots and lots of data, okay? It's big data, supported by cloud computing. It's an awesome thing. And you guys can use this site, I come back over here, um, for so many other projects, okay? They have so much data on so many other things, especially health related stuff if you're interested in it, all right? So again, in terms of doing the critical thinking assignments, you just follow the directions and you're gonna do well. And so not to worry. Okay. We did have some questions about submission. Of course, everything that we do in this class, okay, is via Turnitin. Okay, and this is the Turnitin portal right there. This was an example of what we wanted to have you guys see. Okay, this is the rubric that we use for grading. It's all pretty straightforward. Now, in terms of making sure you get it in, we have a very large class and we have to make it pretty simple in terms of um, um, validating that you've got your assignments in. We do not take a screenshot of the last time that you edited, okay? Um, I have talked to many instructors, not only here at USC, but at other campuses, and that is just kind of a ploy, okay, that students use, okay? Because that is editable. You can change it to make it look however you want. One thing you cannot edit is right here. So it says how to use Turnitin. Okay, so you click right here. Okay, um, and here's a step-by-step process right here. First of all, you can go to their website and get educated. This tells you what's going to happen. Okay, when you are successful, like 99.9% of the Joe 200 was, you get a pop-up that says congratulations. Okay, your submission is complete. It has submission details right here. Okay, um, you also get an email confirmation. Okay, and this, my friends, is something that is completely 100% valid and something that you can send us if for some reason you had a problem. Okay, but that is the only form of validation that we accept. All right. All right, and again, this tells you what you need to do for your submission. You hit upload right here. Okay, um, it will confirm that it has been submitted. Boom, right there. And then again, like we said before, here it is. Congratulations. Okay, and here's your submission ID number. Awesome. Okay, and you will get an email confirmation. All right, very cool. All right, so we are into the two different sections, okay? In terms of the readings, okay, I'm gonna, this is student readings right here. We're gonna go in, oops, sorry, I went to the wrong spot. There it is, to the readings right here. We had the theories of aging and what about aging put us at risk. And these are the three major diseases that impact people worldwide um, as a function of age. They increase with age, and many of the aspects of the theories of aging are the underlying reason for that. Okay, um, we start with cancer, which is, of course, is a very personal item for everybody. Personal for me, personal for Julia, due to the impact it's had on our family. Um, Diabetes and diabetic heart disease. So those are the three biology slash medical areas that you guys can be involved in. And it's important because if we go in here to the cancer site, okay, and we click right there, we start looking at statistics, okay, and they're pretty sobering, okay. And so this is the site that you can go to right here that reviews the statistics, and there's a full detailed PDF file that goes over everything. We see right here we have um, uh, these are graphs that are illustrated in the side. So I'll show you right here. I'm going to open that. So this is a graph looking at survival rates from 75 to 97, and then again from 2006 to 2012. These are giant studies, okay? And looking at hundreds and hundreds of thousands of people, and so we see these changes in rates, okay, in terms of survival rates. So you see this improvement with non-Hodgkin lymphoma. We see not much of a budge with pancreatic cancer, a very aggressive endocrine form of cancer. We can look at improvements in brain cancer, improvements in terms of leukemia, okay? So this is what these graphs are all about. So I'm going to get out of this, okay? And we come back over here. And so each of these graphs are also represented in the website right here. So if you go right here, again, this is the link to the National Cancer Institute. And the very graphs that we were talking about are shown right here, okay? All righty, and you can see cancer trends in terms of death rates and how we're reducing the death rate, or sometimes it's increasing. So you just scroll through this and take it all in, okay? And that's what this is all about. We're making major strides in prostate cancer. In fact, up to this year, we used to say, and I used to tell my classes, that 1 out of every 2 men will get cancer in their lifetime, and 1 out of every 3 women will get cancer in their lifetime. You can see all the different types of cancers. Prostate and lung cancer were prominent in men, and breast cancer in women. Now, because of the improvements that we're seeing here, we see that now it's 1 out of every 3 men and 1 out of every 3 women will get cancer in their lifetime, okay? Still pretty sobering, okay? So please just go through here and take a look at this. Some of this information will come up in the quizzes, okay? And again, we have the actual images of the graphs right here. Okay, awesome. We then go down here, and this is information about categorizing cancers and the biology of cancer, and that's what this particular article is all about. If I click on it right here, so we talk about, there's over 200 different types of cancer, but we do like to categorize them when we're doing investigations, and also when you're doing treatments, it's important to categorize them. And even if we look at something like leukemia, you have acute myelogenous leukemia, you have chronic myelogenous leukemia, you have acute lymphocytic leukemia, or chronic lymphocytic leukemia. And each one of these has a unique sensitivity to different drugs, and that's where the big data is coming in, is that we're personalizing the approach to go after these guys. So this tells you about how cancer happens. It is at the level of the genome. You get mutations. What causes the mutations? We see that diet influences it. We see that exposure to environmental hazards influences, and then you can just have random mutations that happen. And then what happens is you get these drivers that are called oncogenes, okay? These are naturally occurring growth genes that are in our cells, but they get basically mutated, and so their rate of directing growth can be 100,000-fold stronger than normal, and then you get the spread of cancer. And it talks about all the different types of cancers. You have your primary cancer, okay, where it first shows up, and then you see that you get this metastasis is when it enters the bloodstream and will go somewhere else. So you can start with a primary cancer down here, a colon cancer, and then it would come up into the lungs and into the brain. Doctors can look at the cancer cells and say, even though it's in the lung, it is a colon cancer, and so that directs the kind of treatment you give. It's different than lung cancer, okay? And that's the key of being able to categorize cancers, okay? So it goes through the different stages right here. You have precancerous lesions, and it just has to do with the transformation of the cells into cancerous cells that are super rapidly growing, and they also fail to have natural death processes. Okay, so when we look at cancers, there are basically 2 different things that are driving it. So you have these oncogenes that are like gas pedals. Okay, that are basically causing growth, 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 growth. And then there's a whole separate category of gene called a tumor suppressor gene. And these tumor suppressor genes, they naturally do the repair of damage of the DNA. They slow down cell division. And then if the cell looks really, really bad, they have a natural process of pruning it and taking it out. It's called the apoptosis. It'll just remove it so that the cancer doesn't spread. But if you get a mutation in either the driver gene, okay, which is the oncogene, or in the tumor suppressor gene, okay, and these are the DNA repair and cell death genes or apoptosis genes, the tumor will grow and grow and grow. And what happens in cancers is you get a multitude of mutations. The most common mutation is this tumor suppressor gene, where you no longer are able to repair the DNA, and so the mutations just go like that. And you can no longer take the cells out. So they no longer have this natural death process, just really bad, messed up cells just continue to grow and grow and grow. And it's called a P53 mutation, and it's in reference to this one type of protein that is important for monitoring and eliminating DNA damage. Okay, so we have different types of cancers. Okay, we have the carcinomas. Okay, these are epithelial cells, traditional small cell lung cancer, the many different forms of breast cancer. These are epithelial cells. It's the most common by far, the carcinoma, and then that's roughly 70% of cancers are carcinomas. These are much rarer sarcomas, okay, and but they're very, very aggressive, and they happen, as we see right here, in connective tissue. The leukemias are the blood cancers, okay. For the most part, these are a cancer of the immune system, okay, and the lymphoma is where the cancer cells of the immune system are housed in your lymph nodes, and these are your sentries for fighting off infection throughout the body. Once they leave the lymph nodes and get into the blood, then they become a leukemia. And the reason I know so much about this is, like I said, cancers are very, very personal. And I'm going to just flip to my Facebook page right here, and there's a picture of Julie and I a long time ago, before we got married. And there she is, where she had her pre-wedding luncheon, and that's when we got married, right there in Palos Verdes at the Levante Inn. There we are again. That's one of those moments during the wedding where you take pause and just going, oh my God. And that was our honeymoon in Kauai. All right. So why am I talking about here? So Julia was diagnosed with a chronic lymphocytic leukemia 5 years ago. She is my hero. Anybody that puts their cells out there the way she has is a hero. And she's in a clinical trial, which means she's taking a combination of drugs that nobody's ever done before to reduce her leukemia. There's no free lunch when you do this, okay? You're a guinea pig, and you're making your body, your cancer, available for treatment so that future generations will know better in terms of what should be done or shouldn't be done. And so, yeah, she's a pretty amazing person. And like I said, she's my hero, okay? I want to see here, I want to show you another picture of her, which is way awesome. These are all my albums right here. And the reason I like this one right here, so this is like we all went to, my wife and I went to Kauai, and this was our 28th anniversary, which was pretty freaking phenomenal, going back to where it all started before, which was crazy. And those are my boys, Matt and Dave. Matt just graduated from USC. I thought this was a pretty classic photo. We used to go to Kauai every year because I'm a surfing nut. So there she is, about 5 months pregnant with Matt, and here's Dave. So this was 22 years later, which is pretty phenomenal. So yes, cancer is personal, and we're going to talk about the discussion part of this later. Okay, so let's get back in here. Okay, so familiarize yourself with this information. You know, we're all impacted by this. So Julia's dad has bladder cancer. Her aunt died of breast cancer. Her other aunt from the other side of the family has metastatic breast cancer and it doesn't look good. So cancer vulnerability, yes, goes through families, and research this. This video talks about the oncogenes and the tumor suppressor genes, and then you take your quiz, okay? With respect to quiz, okay, we're throwing you a bone. Okay, we did open it up for everybody so that they could take any quiz at any point in time. Here's your quizzes, so they're all open. However, you cannot go back in time, all right? So you see here the quiz is gone for the theories of aging, okay? But if I come back over here, I can go backwards in my browser if I wish, or I can do the other thing you see with cancer. Of course, the quiz is at the very bottom. It's open and ready to rock. That's right there. And that's true of all future quizzes. Now, some of you guys are having trouble keeping up and interpreting this, and so we are going to allow you to throw away your lowest quiz grade in this class, okay? And that'll be then interpreted in terms of your total weighted total, all right? So if you missed a quiz, hey, there's your lowest grade. It's already there, okay? All right, so we, as I indicated, when we're looking at all of these different diseases that affect aging, a lot of them, unfortunately, are very scary. You know, there's no scarier diagnosis than cancer. Believe me, when Julie got diagnosed, it was heartbreaking. And diabetes has severe consequences. In fact, it leads to heart disease. It can lead to sepsis and limb loss. It can lead to blindness, okay? It can lead to kidney loss. So it's a significant disease, which adds a lot of sickness or morbidity and can result in mortality. So, you know, again, these impact many of us. And then speaking of mortality, we come over here to our discussion right here. And we see this week's discussion is all about the end game, okay? All right, so what I'm gonna do here is, there, sorry. Couldn't get rid of that image of me. All right, so in terms of the end game, sorry about the big blow up on my face, we're gonna talk about DABDA and grief, okay? And we want you to discuss your personal experience with grief. It can be something like we've talked about. When Julie was diagnosed with cancer, it was very scary. We cried a lot. We went through the different stages of DABDA, of denial and anger and bargaining and despair, okay, acceptance, okay, and you cycle in and out, okay. Every time something flares up, you can go somewhere back in. This is what we do with grief, okay. It can happen, as I indicated up here, with disease, sickness, and death. It can also happen just from your own personal experiences, okay? It can happen, let's say you lose a job. You break up with your girlfriend or boyfriend, okay? It's all very real, and it's all something that we go through. So I want you to talk about it. I want you to comment on this. Remember, 1 substantive post, 3 comments that has substance. This is the matriarch of understanding grief, okay? Dr. Elizabeth Kubler-Ross, and she's the one who developed this scheme of DABDA. So take the time to watch this video, comment, and do kind of release yourself a little bit. Explain what your experience with grief has been. Okay, so that is it. Okay, guys, and I look forward to looking at your discussion here, and keep up with this. Keep your eyes on future due dates and understand the concept of Turnitin. All right, until next time, we'll see you guys later.